Hi guys! Welcome back to my channel, and welcome back to a brand new video. In today's video, I'm bringing you a rare content that nobody talks about. Chalazion and stye. Have you ever heard of a chalazion or a stye? Well, this is a common eye condition that affects almost everybody, but funny enough, nobody seems to talk about it. In this video, you will learn about chalazion and styes. Watch this video to the end so that you can know the difference between a stye and a chalazion. Stay tuned. A chalazion is a blocked oil gland that appears on the inside of the eyelid, usually surfacing as a bump. An eye stye, or hordeolum, is a smaller pimple-like bump that appears on the upper or lower eyelid due to a blocked oil gland. It is typically near the eyelash and lives on the outside of the eyelid. The eyelid glands, known as meibomian glands, normally produce an oily substance that contributes to the natural tears on our eyes. If these glands become blocked, they could develop into a chalazion or a stye. What is a chalazion? A chalazion is a large, non-infectious cyst in the eyelid that often takes several weeks to develop. It can be caused by either inflammation of the meibomian glands, or it can start as a hordeolum. A chalazion is not painful and usually occurs on the upper eyelid. This is likely because the upper eyelids anatomically have more glands, about 50, versus only 25 glands in the lower lid. Symptoms of chalazion may include the following: eyelid drooping, ptosis, eye redness, and on rare occasions, lid swelling. On the other hand, what is a stye? A hordeolum, also known as a stye, is often more acute and can be secondary to a bacterial infection of the eyelid glands. Styes are contagious but tend to be smaller, more painful, and more tender to touch than a chalazion. Symptoms of a stye can include the following: eyelid swelling, pain, and tearing. If a stye is present for several weeks, it may develop into a chalazion. Who is at risk for chalazion and styes? Some individuals are more prone to developing a stye or chalazion than others. Common risk factors include acne rosacea, chronic inflammation of the eyelids, poor eyelid hygiene, and meibomian gland dysfunction. Common questions about styes and chalazion. How long does a stye last? A stye is a minor, short-term bacterial infection that will last on average 1 to 3 days. Once the stye has drained on its own, the healing phase can last approximately 7 to 10 days. If your stye does not begin to clear up after a few days, it may be time to see a doctor. Is a stye contagious? The stye itself is not contagious. However, the bacteria that cause the stye can be transferred to others where it may or may not cause an infection. Just because the stye is not contagious doesn't mean you should not be careful. We recommend maintaining good hygiene. Do not wear any contact lenses used by others, refraining from using public showers or pools when the infection is active, as well as not sharing personal items with others such as clothes, towels, razors, or cosmetics. How long does a chalazion last? A chalazion typically lasts longer than a stye. They can take weeks to fully develop, and depending on the treatment option, they can take more than a month to go away. In my next video, I'll talk about the treatments and prevention for chalazion and styes. Thank you for watching. I hope this video was helpful. Please subscribe to my channel, and hit the bell icon, so that you get notified when I post that video. Please, like, and share this video. Thank you.